Well, Dr. Pearce, thank you so much for being here on the first official Video for Doctors podcast. Super excited to have you. We have worked together in the past, and I know that marketing, building a digital brand, and using the power of video is definitely something that you believe in. And so today we're going to talk and explore a little bit about, the impact that video's had on your business, why you feel that there's value add from video and building a digital brand to your practice. And I'm very interested and excited to hear more about it. So again, thank you for being here.
Thanks for having me. I appreciate it.
So just for the audience, who are you? What do you specialize in? And let's just start there.
My name is Dr. Paul Pearce. I am a plastic and reconstructive surgeon here in Austin, Texas.
Nice.
So I've been here for a few years now, and been working with you, kind of building the brand and doing it through the medium that I love the most, which is video, because I think it's the most effective way to communicate to people.
You said it. It's the most effective way to communicate with people. And no matter where you research how to grow a practice, how to grow a business, everything always ends up at video, right? And especially with the times that we live in. I mean, a lot of businesses and a lot of practices have been forced to incorporate video, whether it's the Zoom calls, the video conferencing. We needed a digital solution to communication, and video has definitely filled that void. Some of the things I love about video is just, number one, is that it replicates and duplicates who you are, and it allows you to save time. The amount of people that ask you the same questions over and over again is probably monotonous.
It's true.
With some solid videos, you can preempt those situations and make your life easier. And I think that's high value add.
Yeah, and not only that, but with video itself, you get to know someone better because you get to see their mannerisms, how they speak, how comfortable they are in front of the camera, or just kind of talking with someone in general, whereas photos and text on a web page just aren't going to communicate that very well.
True.
And that video really kind of gives people an end to who you are before, especially if you're a physician, who you are before they even come to get to see you. So, and that's one of the great things about video, having that and working with you and kind of developing that.
Yeah. Whether you like it or not, perception is reality and seeing is believing, right? And I was reading this stat, I was Googling, and 82% of all patients look for online reviews or video before they end up booking an appointment with a physician. 82%. That's more than the majority. So what we're realizing is it's not just important for doctors to use video, but patients are expecting to find someone that they relate to. Again, people relate to human beings. They don't relate to brands and logos. But the importance of what your brand looks like and what it represents is also very important. It's been amazing to help doctors like yourself build that digital brand. Because like you were saying, you've seen direct results. We've made some videos, we put them out there targeting certain groups of people. And you've gotten more or patients because of it.
Patients come in and I'm like, well, hey, how did you find out about us? And the one thing that they'll tell me is, oh, I saw your video. Or I saw you on YouTube, which is, where we're putting some of our stuff. And then if they found us on Google or something like that, they'll tell me, I found you on Google, but then I went and watched your videos on your webpage. And that kind of really led me to coming here.
Powerful.
It feels
so
great
powerful.
Once I hear that.
Again, that's why I believe in this, because we're already seeing it work. And I know that a lot of people out there are looking for solutions. How can I grow my practice? Oh, more print advertising, or I'm going to advertise on radio. And, as wonderful as that is, the power of being able to know who's watching your video, when they stopped, when they start. We get so much more data by using video. It's mind-blowing.
It really is, because it's nice. Like, if you're advertising, I mean, I've had people come to me and ask me to advertise on radio, but the one thing I never could get behind is how many people are actually really going to hear my ad. I mean,
you don't know.
I really don't. Whereas if we have a video, I can look at the metrics and see how long did they watch that video for, what point did they jump off, and that kind of helps me improve the next video and kind of develop it from there. So
definitely,
there's a lot more data that you can pull out of a video versus throwing out a print ad. I mean, who knows how many people are actually going to be looking through that magazine, kind of looking at that.
We know data is important. I mean, imagine going into surgery, not knowing who the person is, what their problem is, but you just go in and you start working. You know, like that makes no sense.
But I mean, for those type of situations, you have years and years and years of training, so you have a kind of a thing of what to expect when you go in for that. But as far as when you're developing video and you're developing a brand and you're developing your practice, you don't learn any of that in medical school or in your residency. You have all these years of medical training, but you have no training in how to get patients into your practice unless you're getting tons of referrals from someone else.
Sure.
So that whole process of kind of developing letting people know who you are and what you do and how you do it, it's the best way to do that is through a video, because then people get to see what your personality is like and how you speak and what they can expect when they come to see you.
Which is honestly really what they're looking for.
Yeah.
I mean, they're looking for a doctor that they can relate to, they feel has a genuine passion for helping people with the problem that they have. And I feel like that's what patients are making decisions on.
Yeah.
Okay, so one of the things I really love about video is that it makes a lot of doctors ask the questions that maybe they haven't asked before, which is like, what is your messaging? Yeah. What is the core thing? Like, what's the angle you're really approaching people with?
Yeah.
And so through the Video for Doctors process, when you went through the video press kit, the main questions were, what problem is your patients dealing with?
Yeah.
How are you qualified to help them with that problem? What's the vision of the future once they fix that problem? What's life going to look like for them?
Yeah.
Those are like the core questions that if we can come up with answers for those, when patients hear those and see those things being talked about, it's like we're addressing their hesitations and objections before they even had to bring them up.
That's true. And it really, those questions that you had asked, those are things that I had thought about, but I had never really kind of tried to put them into a coherent sentence to
format,
to let people know that that's why we're here. This is what our aim is to do. And it was, it was great to finally see that on video, because now it's in concrete, it's there. And
when I show people your video, they like, I have hair, but I want to work with Dr. Pearce, because there's a genuine sense of empathy, compassion. It's like built into the video.
Yeah.
And I really contribute that to the process of how we do it at Video for Doctors. It's the structure, it's the format of how we're strategically designing that video experience.
Yeah, because you have to bring that to the forefront so that the patient gets it, they see it, and they acknowledge it, and that's where I want to go. That's what I want to do.
So, just for other doctors out there and for yourself, where do you think, as we continue to use video, as we continue to go more digital within the communication process between doctor and patient, what are some other things that you feel are important that you're working on and trying to set up right now for your own practice?
I mean, as far as video goes, and
marketing, video, building your digital brand, how you're positioning yourself. I mean, video's definitely a solid avenue of exploration.
Yeah.
And we're talking about that. But that can't be it. Like, what else are you doing to make the patient experience better, make your whole communication experience better?
A lot of it really comes down to just a whole broad range of technology and making everything from getting the appointment to be easier made and for them to get reminders that they're coming in. So on that aspect too. But the other aspect really is kind of educating patients and letting them know, even from either cosmetic stuff or even the reconstructive stuff, just kind of developing all that and letting them get more education about what's going on with them and what to expect after surgery. The other aspect too is more the humanizing aspect of physicians. So, for a long time, physicians, they're kind of seen kind of up here. You don't really, a lot of respect for them. Right? But in reality, we're all humans. I put on my pants one leg at a time. Some physicians may not, they may do that in a different way. But for me, it's really kind of letting people know that I'm human, that let's talk, let's have a conversation. It's not like, just giving orders and things like that. That's kind of like the old school dogma way of it. Whereas now, patients really want to see that they're interacting with a person. Yeah. And it's one of those aspects of video where it's the short form stuff that you see on like TikTok or Instagram. to the stuff that we do here for our website and for YouTube. All of those things come into play as far as developing a relationship with the patient. Because the more that they see of you, the more that they're comfortable coming to see you and talking to you about the things that they want to see changed.
Yeah.
And that's really the main thing and that's what I tell all my patients on their first visit is, today is not the day to decide if you want to have surgery with me or not. Today is the day to decide if you like me, if you're comfortable here, and then you can decide to come back and have your surgery here. But really, today is just kind of it's almost like a job interview for me.
Sure, right.
So, in having those videos and all that technology to kind of make their experience better, it makes them more comfortable. And then once you're more comfortable with things, then you're more likely to say, all right, yeah, you know what, that's the place for me. That's where I want to be.
It's amazing to hear because that's specifically the goal that we were trying to accomplish when we started making these videos.
Yeah.
And that's why the hook phrase for Video for Doctors is helping doctors build a better connection with patients online. It's not just about getting any connection, right? Because there's like low quality connections and there's high quality. Yeah. And once you have a practice that's already doing business and now it's like, well, I just don't need more patients. I need higher quality patients that are, one, need exactly what I have to offer. Yeah. They are ready. They've been educated, and that's a high quality patient right there. People don't like to be sold. No. The culture of how we sell things these days, people are against selling, but they welcome education. And that's why, again, these videos is like, one, letting them know you, like you, and trust you using video. We have a segment called Expert Advice. And for you, we titled The Plastic Life. And what did we do? We broke down the procedures, the processes that patients would go through. And by doing that, we're going to encourage them to make calculated decisions on what process feels right for them, what doctor they relate to. We're winning, and we're in the money now. I mean, like that's literally what we're trying to accomplish.
And it works out great. I mean, once you have that kind of superficial video relationship with the patient, then they have that experience like, okay, well, I feel comfortable watching that person on TV or on video. And then once they come in to see you, if you're still that same person that you were on camera, then that kind of adds to it. That validates what they already saw. And that just kind of builds the foundation for that relationship from there. They
say video it won't make the handshake for you, but it'll open the door for more handshakes. Really, it's the preemptive. Something really cool about your practice is that you have you specialize in hair transplants. But you also have a specialty piece of equipment. You have special technology that helps you do that. Can you tell me a little bit more about that?
So we were the first practice to bring in robotic technology to help assist with hair transplantation surgery. So hair loss is something that affects a number of men. I mean, I'm probably starting my own journey right here.
I'm starting right here. No.
But I mean, the vast majority of men experience hair loss as we get older. And it's not something that we really welcome. It's not something that we really want. So, I kind of took a look around, before I set up my practice and where's an area that I could fit in and do something a little different. And bringing in the Artis IX, which is the robotic technology from Venus Concepts, to kind of help assist with hair transplantations is something that kind of really set apart my practice from everybody else. But since we just had that brand new piece of technology, we needed a way to do that, to really get it out there and kind of tell people about it. So, through the various pay-per-click campaigns and, Instagram and all that stuff, the video really kind of eases people into it because I have a whole video on it, kind of explains how the day goes. And that really kind of helps people be a little bit more at ease of how that technology works for them and how it's going to help them through their hair transplant process.
Do you find that more people are finding it easier to approach you these days? I feel like there's a little bit of a stigma behind like, I'm going to go get hair transplants. But now it's a little bit more commonly talked about. You see the advertisements for the hymns and the other things. And so I feel like that conversation is being brought out to the forefront a little more.
It really is. It's kind of like, plastic surgery in the 70s and 80s, it was kind of hush-hush. Like you didn't really want to talk about it. But now that's coming to the forefront for hair transplants as well. I mean, getting your hairline back and kind of recreating that, it makes you look and feel younger in the long run.
Yeah.
So yeah, I mean, a lot of guys are getting more and more comfortable with it, and some guys are very open with it. We still have a few that are like, I don't want anybody to know about this, and that's perfectly fine. But yeah, more and more people are starting to get more and more comfortable.
Shout out
it.
to Elon with the hair transplant.
I was going to say that. Yeah, exactly.
Help him bring it to the forefront.
Right?
Pioneer.
Yeah. I mean, whoever did his hair transplant, they did a great job.
Yeah, absolutely.
Yeah.
No, there's something about, this as doctors, anyone aspiring to do more than what they were born with, for aspiring for greatness. There comes a time to where the way you feel, the way you think determines how far you're going to go.
Yeah.
And I think once you get into that game and you become a player and you start adding to your arsenal, you have high value skills, you have education, you're putting good communication out. Well, now you got to work on the mental and the inside. If you need a little hair transplant, if you need a little this, a little that, I'm all down for those things because, again, perception is reality.
Yeah.
And seeing is believing. And if we can do some of those minor alterations to the body that we have, it could help us up our game by 10, 20, 50%.
Yeah, I mean, that confidence. Because once you have just that little boost in confidence, things seem to just suddenly open up.
Easier.
Yeah. I mean, because you feel like, all right, yeah, I can do this.
Yeah.
I feel better about myself. Let's go do this. So, I mean, I've had guys come into the office. They're very quiet.
Yeah.
Very, But after we've done their hair transplant, and it's been about 9 months to a year later, and they're starting to see their hairline come back, they're more confident.
Start a little more swagger.
They start talking to my staff a little differently, and it's and I hear it. I hear it from around the corner while I'm writing their notes and stuff like that. I'm like, wait a minute, is he about to ask her on a date?
Done.
Like,
Job well done.
What's going on here? So things, it definitely changes. It definitely can
life changing.
Yeah, boost the confidence for sure for guys.
I feel like those things are important. So there's a lot of go-getters out there. Don't be embarrassed. Don't act like you're not allowed to change anything.
Yeah.
Figure out what you need, and Dr. Pearce is definitely here with the technology to help you reach that goal.
Yeah.
Okay, so another question back on the practice and marketing.
Yeah.
So you've been launching pay-per-click advertising campaigns. We've been using video on these things. Mm-hmm. When people come in and they watch the video, where do you see the greatest results? Are they calling? Are they booking an online appointment? Once we get their attention, we get them to know, like, and trust us, how do you transition that to an in-person sale and meeting?
I think nowadays it's once the video's been seen, once the information's been given to the patient, a lot of it is kind of through email or text. We have text messaging set up as well. People rarely want to talk to another human being as far as when they're setting up that whole process. I don't often get phone calls to kind of set up an appointment. It's either an initial email or it's an initial text message to the practice, and then from there my staff takes it from there. And they'll reach out to the patient.
Through.
Yeah, and then the follow through. So really then it comes down to who you have answering those text messages and those emails and those phone calls. Kind of comes down to it. Because that's the person that's the first person they're talking to in your practice. So that person is very important as well. And from there though, I mean, I'm very, very fortunate to have excellent staff that I work with. So they do a fantastic job of getting our patients in and making sure that we get them in on a timely manner, a good schedule for them. So I think kind of having that technology where patients initially maybe they don't want to talk to somebody just yet, especially if it's a situation or a issue with their body that they don't really want to talk to somebody about on the phone. Then they can set up that email, and it's all through technology. It's kind of a couple strokes on the keyboard, and then they're off and their journey starting.
Have you heard of so there's these AI programs out there that you can go and they'll do like the chat bots and stuff like that, but they've gotten very advanced.
Yeah, I've heard about those.
You can have full-on conversations and they will respond in conversation.
Yeah.
And I look forward, I've been doing a lot of research on that, and there's a couple different avenues to where you can set that up. It just takes a little bit of effort on the physician's part or the marketer's part to just set up that communication flow.
Yeah.
Because there's only so many questions.
Yeah.
Hey, are you having this problem or this? You know, and they answer. And then, but man, I mean, imagine a day where this whole thing is automated.
Yeah, or from the start where they see your information.
Piquing interest,
yeah,
learning about what you do, who you are, knowing other people have used you and they give the cosign, to even automating the sign-up process.
Yeah.
Booking their own dates.
Yeah.
Booking their own, you know what I'm saying? Like,
Yeah.
that is where it's going, and I look forward to keep learning about that and instilling those practices.
Yeah, because it's all about that ease of use for the patient.
Yeah.
You know, from start to finish. It's that whole ease of use, because once you start putting in little minor inconveniences for patients, they're out.
At a certain point, it's going to come down to who has the least resistance
Yeah.
to entry.
Yeah.
Some doctors is probably, if they only accept phone calls, they don't check their emails, or
Yeah.
they don't have automated text campaigns and well, it's just not going to be as good of an experience, and they probably won't work with you for very long.
No.
Unfortunately, it hasn't always been like that, but
Yeah.
whatever worked 5 years ago, 10 years ago is not what's happening
No,
today
it's a
and
whole
tomorrow.
whole different scene now.
Yeah.
Yeah.
Well, great conversation. I really, truly appreciate you being here.
Yeah.
I've met a lot, doctors and tons of people, and you are truly a quality human being.
Oh, well, thank
and
you.
I've always enjoyed working with you.
Well, I appreciate
it. And, if anyone, again, is looking for a hair transplant or any type of cosmetic surgery, Dr. Pearce is the man.
I appreciate it.
Yeah, we'll be seeing more of these clips. And,
Yeah. And we're not done working together yet.
Absolutely.
We have some more stuff we need to do.
Absolutely.
All right,
Video
cool.
never sleeps.
Exactly.